Welcome, Isabel. I'm so glad you're here with us today. And I can't wait to dig into the dementia aspect. And you are a dementia specialty nurse, correct?
Yes, I was what we call out here a clinical nurse consultant.
Whoa, but it was specifically on dementia, pretty much, yes?
Yes.
Mhm. Tell us a little bit about yourself and how you got down the path of becoming in the dementia. Was that your dream?
No, as I write in my book, it was the furthest thing from my mind to find that I would be working in aged care for most of my nursing life and to spend the last 25 years in dementia care specifically. When I was doing my nursing training, dementia was older people sent to the psychiatric unit and just locked away. And so I had no interest in psychiatry, but my husband left. I needed a short-term job, short hours. I got a job at one of the local hostels as a clinical, just the care person to a project that focused on activities for people with dementia in the hostel. So we had a small group of 12 people that we cared for, basically in that group during the day, looking after them, keeping them occupied
Wow.
in a 60-bed hostel.
What was your dream job at the very beginning of your career? What were you thinking about?
Oh, that's interesting.
Weren't you going into birth or something, or birthing, or?
I did midwifery, but I think probably surgical nursing would have been where I would have gone. So right away from the older people who end up in the medical wards.
Oh, wow. How many types of dementia are there?
Look, there's over 100 different types of dementia. We all know about Alzheimer's disease, and a lot of people even think when they say dementia, they mean Alzheimer's, but that only accounts for between 50 and 70% of people with dementia. There's vascular dementia, there's Lewy body dementia, and then there's the next common one is frontotemporal, where it affects the frontal lobe. But there are, again, over 100 types of diseases that cause the symptoms of dementia.
Wow. So if a family member notices that something, might be happening, and they suspect dementia, where would they start? Where would we begin?
The best thing to do is talk to their doctor. Now, don't take the person along with you when you go for that interview with their doctor. You need to alert the doctor that there are concerns, because the person who's beginning to get dementia will go along to the doctor and put on the usual social facade. I'm here for my medications, doctor. Can I take your blood pressure? Yes, doctor. How are you doing at home? I'm doing fine, thank you, doctor. And outside, you've got a carer thinking, why can't that doctor work out that this person's not all there? From about the time you're in the doctor's appointment, you can keep up the social facade. And so what they need to do is either talk directly to the doctor or send the doctor a letter outlining all the things that they're seeing and what their concerns are.
Oh, that's good. That's really good. When I went with my mom first time, and she said, I said, which I should have written, I didn't know what I was doing. I said, she's had a stroke. And she said, I did not. And it was clearly she had. And we kind of looked at each other, and then, tests, etc. But I wonder why at that point she felt like she didn't have a stroke.
There's denial. I don't want to admit there's something going wrong with my brain. I don't want to think that I'm getting older and I'm not coping. So there's this protective mechanism in place that's refusing to accept that there might be something wrong. And certainly with the person with dementia, they don't realize that they're having a problem. They think everything's okay. So when somebody confronts them, like in a doctor's surgery, with things are not going as well as they should, immediately they're going to react negatively.
Gotcha. Awesome. Could you share a little bit about what about the angry dementia person? That just tell us a little bit about that, if you would.
Yeah. Look, the anger can come out of a whole heap of different things. If you're in pain and somebody moves you and that hurts and you can't explain to that person, you hurt me, you'll get angry. You'll react angrily. If somebody's undressing you for a shower and you suddenly don't know who they are and why they're doing this to you, you will get angry. If you're a person who's always been in control through your life, what's termed the choleric personality, always the one who told everybody else what to do and was controlled the environment around them. And then
You're talking about me now.
Yeah, somebody is telling them what to do. How dare you start telling me what to do? And families will often say, but they've not been angry before. And that's because the family knew when dad said jump or mum said jump, they asked how high on the way up.
Yeah.
They didn't ask them because they knew they were the one that was in control. And now the person is trying, other people are trying to direct this person, tell them what they can and can't do. You've got to find ways to make them think they're still in control.
Can you suggest ways, to have a person maybe go down each personality, kind of like, how can you,
I'll just finish this bit because there was a nurse that we had that did this really well. She would say to the person in the morning, would you like to have your shower now? And if they said no, she said, I'll come back later. She'd go away. She'd come back before breakfast and say, it'll soon be breakfast time. Would you like to have your shower before breakfast? No. Okay, you can come to breakfast in your pajamas. Later in the morning, oh, it's about 9 o'clock, 10 o'clock now. We'd like to go outside. Would you like to come with us? Yes. Well, would you like to have your shower? You better put some clothes on before you come outside. She would go through the day like that, and by the end of the day, inevitably, she would have the person through the shower.
wow.
And there would be no anger. There would be no rejection of, don't you tell me what to do. She'd managed to do it. So the other personalities, the sanguine. The sanguine's the life of the party, the person who is always in the centre of a group of people, and they're fine until they can't communicate or they're not being communicated with. And then it depends what their other mix of their personality. If they're choleric, they'll start to get angry and people say, boy, have they changed. They were never angry. They were never angry before because they liked people. They didn't get angry with people because they wanted to stay friends and be included. But now they're being excluded. They feel they're being excluded, and that choleric might come out.
Yeah.
Then you've got the melancholy, the sad, the person who's prone to get depressed. Things don't go their way, they'll probably get depressed, but they also may have a bit of choleric in there too. And, they're trying to do a painting like they've done it before and they throw the paints because they can't do it to the degree of perfection that they wanted to before. And then you've got the nice, quiet, phlegmatic who just goes along with the flow. But you do something to get that person upset For me, you move my pile of papers and get them all in a disarray because I knew where they all were. You'll find that underneath this night quiet phlegmatic, there is a bit of chloric there too. So,
Gotcha.
yeah.
Hey, I didn't even let everybody know like where you're from. Obviously, you have a wonderful accent. So tell us a little bit where you are.
Okay, I'm in a place called Wagga Wagga, which is the biggest inland city in Australia. So born and bred here, did my nursing training at Royal Prince Alfred in Sydney and midwifery in Melbourne, and have lived in this beautiful city for the last 42 years. Yeah.
Wow. Wow. That's awesome. What kind of unique things did you do with, I think you were over other people, right? I mean,
yeah.
yes. And
Yeah.
what kind of things did you do with that were unique kind of for the people with dementia?
Okay. Well,
And how did they live also, like community or what?
Yeah. Basically, I seem to move from project to project. The first one was the project in the hostel, where that was a first off project, seeing if doing those small groups with people with dementia would improve their life and also the life of the other people in the hostel, because it was a 68-bed hostel with 12 people with dementia in it. And so being able to work with them in that environment helped engage them throughout the day. It kept them occupied and did prevented the wandering and the other behaviours that you might have seen. Then I did another project, which was the first psychogeriatric nurse with our aged care team. And there I met Dr. Williams, who was our psychogeriatrician. He had a big influence over us, all of us, for the next 20 years almost, that he was the visiting psychogeriatrician. And we'd travel around the area and I'd get to sit in the car with him while he dictated his letters, having already assessed the person before he saw them, then being with him while he assessed them, and then hearing his outcomes. And then the next project was a community project, setting up respite for carers in the community. And basically I got that job because I had this idea that if we got a group of people with dementia, a group of ladies, say, and we did something that was very normal, we took them to each other's houses for morning tea. And so we would take the group and one carer, and they'd go and visit the first person's house and they'd have morning tea there this week. Next week, they'd visit another person's house and they'd have morning tea. So every 4 weeks, you got this group of people coming with dementia to your house.
You mean to what kind of a house? You mean the family's house?
The family's house. Like you would bring, and the carer had the opportunity either to stay and be involved, or go to the bedroom and have a sleep, or go out and do the shopping while they were at the house. And the other people, all their families, they could do whatever they wanted for that morning. They had the morning off. They didn't have to worry about their person.
Oh, I see. And you're saying carer, you mean caregiver?
Yes.
Okay.
Yes. Okay. And I'd send the staff person. They'd have one staff person, 4 people with dementia in the house, making cups of tea, and she'd take some activities for them to do. And but it was normal. I mean, it's a normal. I grew up with my mother having morning tea parties. So for these people, it was a normal thing. For the men, we'd send them down to the lake to go fishing or go and have a barbecue or do something that men would do.
Wow.
And so, and then we also did overnight respite. So if somebody, if a caregiver got sick, we could send in somebody to stay with the person with dementia before, while the family was still coming. And we did some holidays. We actually took some people, a group of people with dementia, plus our staff, plus if the caregivers wanted to come, they could come to Canberra for an overnight 2-day excursion. There's a beautiful flower show, so we took them to the flower show. We went to the War Memorial. We went to the, they had a choice of going to the Mint or the National Archives. So, and the caregivers had a choice to go shopping if they wanted to, or one man went off and saw his family while we took his wife. And then that night, the family came to dinner with us all at the hotel. So just ways to make life normal and involve people in activities that they would enjoy. Yeah.
Wow. That's amazing, because in the US, overall, you're put into a memory care unit and basically you stay there pretty much. They have activities and things, but it's not as near as creative as what you're doing in Australia. And that's even years ago, right? I mean, really.
Yeah, it was 2000.
And then you had
then
you had a dance thing or something too, didn't you?
Yes. This was back in the 90s when I was working with the first group of people with dementia. We a group of what are called diversional therapists or activities officers. We went to a conference in Sydney, and on the way back in the car, we were all traveling together. We'd heard about these taking people, older people, to dances, and we planned a ball, like the full-on ball gowns, ball decorations, belle of the ball, suppers, the whole thing, to be held at the local big hall here, where all the balls would have been held when the older people were younger. Mm-hmm. And the local geriatrician actually played in the band. So,
oh my goodness. Awesome.
and that went on. I went about a few years ago to the 25th anniversary of that still happening. Wow. Yeah. So wow. We wheelchair dancing. It wasn't just for people with dementia. It was for anybody who was in aged care, either in the community or in the aged care facilities.
Wow. Yeah. Okay, in the dementia hostel, or however you want, I don't know what the right term is there. How many people are in a room? Is it just do they have separate apartments or?
No, the government here moved to single rooms probably 10, 15 years ago, that everybody should have a single room. Originally, that you could have a 4-bedroom, up to a 4-bedroom with people with dementia. But now most facilities have managed to move to that single room. Yeah. But from my point of view, I'd rather have at least 2 people in a room, because if something happens with the other person, at least the other person can call out and, alert somebody. And they've got company. Yes, sometimes they mightn't like the company they've got, but I visited a nursing home where they were just starting to make it all single rooms. And I was talking to one of the residents, and she said, I don't like it. I see the staff half as much as I did before, because when they were caring for 2 people, the staff person was in the room for 2 hours, not 1. And I've got nobody to talk to. I've got to get myself out of my room to find somebody to talk to. Mm-hmm. And there's half as much visitors, because the visitors would come and see both people.
That's true. That's true.
Lonely in the single room. And it was an interesting comment.
That is interesting.
Because all the younger politicians, of course, all thought, I want a room to myself. And so let's make it all single rooms. They didn't really ask the older people, do you all want a single room?
That's good. And then, okay, so when you took them overnight or whatever, and you took them on outings, people with dementia, how do you get down to the care of, because there's a lot of things that can happen.
There are. And basically, when we went on outings, it was usually, well, sometimes we did send 3 or 4 people with one carer. I'm just recalling one instance where there was this lady who when the carer would come to the house to pick her up, the staff member, she would play hide and seek. She would go and hide herself in the wardrobe. She'd just say, "Excuse me, I'll just go and get something," and she'd leave the room. And the girl would be waiting and waiting, and finally she realised that this lady loved to play hide and seek, and that she'd be hiding in the wardrobe. She was ready to go out, and she wanted to go out, but she just wanted to play a little game before she went. Well, one day she was part of a group. I think there were 3 other ladies that had, with this same caregiver, the worker, who had gone to one of the big shopping shops, sort of not Walmart, but it was a big similar. And I got this phone call. I've lost this lady. I don't know where she is. She's somewhere in. We're in this big shopping shop. I said, "Well, look, you go to the." Fortunately, it was only about 2 minutes away from the office. I said, I'll meet you at the back. I'll look after the other 2 ladies you've got with you. You walk through the shop and go to the front door and see if you can see her anywhere in the shop. If you can't, then go to the management and we'll put an announcement over asking her to come." Anyway, as she was walking through the shop, the lady was hiding amongst the clothes, and she popped out from amongst the clothes with a boo.
That's just like a kid, right?
Yes.
Oh my goodness. Yes. Oh my goodness. Oh wow.
So,
wow.
When you're planning an outing, think about where you're taking them. Try and go to the place beforehand. Check if there's any ramps, exits, where the toilets are, all of those things, so that you've got a plan and you've worked out all the safety issues. I did lose somebody in the War Memorial when we went to Canberra. It was a younger man, and we were up in the old World War I exhibition, and I looked around and I thought, he's gone. Where would he go? I thought, he's younger. He might go down to the Vietnam exhibition. So I hopped in the lift and went down to the Vietnam exhibition, and that's where he was.
Really?
Yeah. Wow. I mean, he had enough nous and enough insight to take himself somewhere, but he probably wouldn't have been able to find us.
Right.
Himself. Yes.
Wow.
Yeah.
Wow. So what drew you the most into working with dementia?
Well, I mean, once I'd spent a year and a half with that first group of people, you realise that there was just so much history, so many stories, so much connection that you could make with them on that emotional level. Yeah, I think when I was doing my nursing training and thinking about people with dementia, it was like, they don't know anything, or they're just senile, because that was the word we used back then. And but having that time with them individually, you got to know them, you got to make friendships with them, you got to realize that the person is still there, the emotions are still there. You can't ignore them. You can't just send them away somewhere. And I suppose the thing was that, yes, as a Christian, I just wanted to do the best I could for these people, And I always looked for what's happening with this individual. Why are they behaving like they are?
Mhm.
And I've always loved detective stories and detective shows on the television. And I think it was that, what's going on for this person? What's behind this behavior? Why is it so? There was a Professor Julia Sumner Miller used to come out to Australia and run summer science schools. I think he was trying to get away from your cold winters, actually. And his question to the students was, why is it so? And that becomes my question about people with dementia. Why is it so? What's behind this behavior? What's driving this person? What's driving this man to go out at night and dig a hole in the garden and bury his clothes, or put them in the toilet and try to flush them down the toilet? What's behind this behavior? Where's this coming from? Then we discovered that he'd been in the military. The other things that he was wanting to do was he was wanting to wear a face mask. This is way before COVID, to the dining room.
Popular, yeah.
And he wanted clean sheets on his bed every night. I think there's something, he's worried about infection. He's worried about contamination here. Why would he be doing these things with his clothes? And then we discovered that he'd been what we call in Australia a rat of Tobruk. He'd been in the Second World War, he'd been in the army, he'd been under siege conditions in Tobruk with the Australian army. The German army had encircled them, and their backs were to the sea. There was nowhere to go, a bit like Mariupol in Ukraine now. He had been a medic. He had obviously been a medic. Well, what do you do with contaminated clothing if you're in a siege situation? You need to get rid of it. You go out at night and you bury it in the desert. When I was doing my nursing training, we used white enamel buckets to soak blood-stained bandages and clothes and things in. What does the toilet look like? White enamel bucket. Okay. What do we do with contaminated waste nowadays? I mean, this wasn't just me. This was all of us in the office working together, brainstorming. Well, we've got a contaminated waste bag that we put everything in. Let's put a contaminated waste bag in his room. It's got contaminated waste written all over it. Tell him he can put all the infected stuff in there. And so that's what he did.
Wow.
He stopped wanting to wear the mask to the dining room, and we would change his sheets every day. The staff would take 2 sheets out of the room and bring 2 sheets back in. What he didn't know was that for a week, those 2 sheets they took out were the same ones.
Yeah.
Yeah.
But what a loving thing to do. What a kind thing to do, really, to do that. I mean, that takes effort and
Yeah.
And into them.
And it's sort of, why is it so? Why is he doing this? What's behind it?
Isn't that a great question? That is for so many things besides dementia too.
Yeah.
Why is that so? Because it takes us out of our own little, well, I think it's,
Yeah.
To look at it. Yeah.
And it takes us away from that, they're just doing that to me. When the person gets angry or pushes you away because they don't want to be undressed or something. Well, why are they doing that? It removes the sense of they're having a go at me, to put it in Australian vernacular.
Yes. Yeah. Let's see. Lila asked to tell a story about a quilter folding toilet paper or something. Yes. Okay.
Yes. Okay. This is one of my colleagues' mothers, and she's been making quilts for years. Beautiful hand-stitched, wonderful quilts. She's now in an aged care facility, and the daughter arrived to find her tearing up pieces of toilet paper and arranging them on the vanity. And straight away, she recognized that this was Mum arranging the material for a quilt.
Oh, wow.
Yeah, yeah.
How beautiful.
Now, the staff would look at it and say, oh, this stupid old woman,
Mhm.
why she's tearing up toilet paper. How stupid is that? But there was purpose behind it. There was reason behind it. So that's why it's so important to know people's background. Like I could see my daughter, if she ever got dementia, doing that. I mean, she's been quilting and she's had quilts exhibited in quilt shows recently. Yeah, the pieces for the quilt are so important and so integral to what you're doing. And it's been an everyday activity. So of course she's going to be wanting to rearrange bits of something. So give her a pair of scissors, give her a coloured paper, let her cut it up. She'll be happily doing it for hours.
Yeah, that's awesome. One thing I ran into was with my mom, 13 years caregiving for, was that people would say, what good is she now? She was in assisted living at some point. What good is she now? She, I just think it's awful. I wish she would die. And I think it was their uncomfortableness. Looking back, it just ticked me off at the time. But looking back, I think it was their uncomfortable with what she was going through. Many would not come to see her, and she was a person who cared for the elderly a ton. And so it was fascinating that it was too painful almost, they thought.
Yeah, some of it is fear that this is going to happen to me. And I don't want this, so why would anybody else want to be living with this? But what they've got to realise, that was probably very negative, but we need to help people to understand that the person is still there. The emotions are still there, right till very close to the end. They may not be able to communicate as they have before. They may tell you your same story over and over and over again. And every time you go to visit, I've got a friend who's developed dementia, and two of us will go this afternoon to visit her. She's 85, her other friend's 92, and I'm 70, so something. So yeah, we have this visit, but nearly every afternoon the conversation goes round to, I had a really good father. And he only had to raise his voice and say, girls. And we knew we were in trouble. And we had a house that had a balcony around the inside upstairs. And we would run around up there all the time. And their dad would say, girls. Now we get that. See, I can do the story because I've heard it every week for the last 2 years. You just accept it and you move on, and you talk about how she loved her father, and obviously her relationship with her father was probably better than her relationship with her mother, because she hardly ever talks about her mother. But you just go along with it, and then you may talk about, change it to something else, the weather, whatever else you want to get to. But just to listen to the story.
Yes. Have you ever thought about, someone brought my mom a teddy bear one time, and it was when she was pretty quiet, only would talk to me every day and nobody else really. She just chose not to. But she brought this teddy bear. And so I came in that day and they put the teddy bear by her. Okay, that was a little hard for me, her daughter. I'm like, how demeaning in my head. But when I came in, she goes, shh. I said, what? She goes, don't wake up my baby.
Yes.
And you have a lovely one. But I just went into her world at that point. I spent a lot of time not going into her world when it first started, because I didn't know what was going on. It was like, is she just being ugly? Or because she was a lovely lady, but you know, it was
Yeah.
it was confusing. So
Yeah.
did you ever find that, like, giving them a doll or something? I don't know.
Oh, yes. Yeah, the person is going back in their memory. So they're going back through their life to the point where, I mean, even at my age now, I don't think of myself as the age I am. I'm probably 10, 15 years younger in my head.
Yeah.
So I haven't got dementia. If I got dementia, I'd probably be 20 years younger in my head. And gradually it goes further, the memories go further and further back. And they're the mother. They're the mother who's looking for the baby, who's looking in the afternoon, who's looking for the children coming home from school. I've got to go. I can't stay here. I've got to be home. All of those things. What the doll does is often the doll or the bear, like you said, becomes the baby. And they're looking after. They're having purpose and meaning. It gives them a reason to be where they are and doing what they're doing. It gives them occupation. It gives them emotional connectedness. All of those things that they need, they still need. There's 5 basic: occupation, attachment. They're not, the rest of them aren't there in my head, but there's 5 emotional needs that we all have, and having a doll often meets those. The important thing is always treat the doll how they perceive it. Yes. If they say, look at my lovely doll, you're looking at a lovely doll. Yeah. If they say, shh, don't wake the baby, you're dealing with a baby. Yeah. Sometimes that looking after that baby is bringing some closure to their life. I had a man who would take the doll, dress it and undress it, and he called it by the name of the child who had died as an infant. Oh, wow. Wow. So for him, it was some closure. Wow. Yeah.
One thing I did was bring a piano into my mom's room, and about 3 feet from her bed, and played the piano for her, usually hymns and things that we liked. But one time she had a birthday, and for some reason she perked right up for the birthday, and she wanted to sing. This is my mom, and very godly. She wanted to sing "There Is a Tavern in the Town." So I played it, and the whole family sang it. I mean, several times, and she was singing, and then she would sometimes just tap, on herself, oh my goodness, we laughed so hard because she didn't drink. She didn't, she wanted to sing it. There is a tavern in the town. We're like, all right.
We'll be going around the mountains when we go.
Yes. Yep. Yeah.
It's those songs that from their childhood, basically. Yeah. You think about when There Is a Tavern in the Town would have been a popular song.
Yes, there it was.
It was easy to play. It's not a hard one to play. So, and you've got to think back then, it's the piano in the lounge room that we all gather around and have our sing-alongs around. The radio may have been there, but it wasn't used a lot. It was more what we did as a family.
Yes. And
she's got all the family together. We've got a piano. So therefore, I want that song that I remember from my childhood.
Yep. Did you ever do this? I don't know, like she couldn't remember exactly who she had been. And so I wrote it on a, laminated a sheet that said basically what her career was and what she loved and etc. And people would read it to her when they came. And it was really useful to kind of give her a sense of grounding her. I don't know. What do you think? I don't know.
I think that's great. I mean, I'm all for getting a history, personal history for the person. I've actually got 2 pages on my computer that the kids know it's in funnies, where to find it. And it's all the things I like and don't like, and all the things songs I like, all those
Oh,
important things that people need to know about a person to help them be settled. So when the staff come in to get somebody in the shower, they know that their favourite name is Patsy, for example. And Patsy had a dog named Snoopy. And Snoopy was very special to Patsy when she was growing up. Oh, well, how's that? Jock's just started to howl. He knows I'm talking about a dog.
I love it. I love it. Go ahead, that's fine.
And so the staff member starts to talk to the person about Patsy, about Snoopy, and this person thinks, oh, this person knows me. I can trust this person. They're a friend.
That's good.
So having that history there for the staff to look at, then they can engage in a conversation that's relevant to that person. You know, while they're showering them, while they're doing personal care, while the person's feeling embarrassed and not happy to have this happen, the person can talk to them about something they like. You know, their favourite flowers, their favourite song, they can sing with them. All of those things can happen in the midst of a very, embarrassing time, and it removes the embarrassment.
You developed a shower.
Right.
Explain what that is, because it will be available at some point.
Yes. So basically, it's just a cotton wrap that goes around the person, does up at the back, a meter, or your feet, about 2.5 feet long and about 3 feet round, and covers the person. It's got elastic around under the arms, and you can pull the night gear up underneath it. You don't have, the person is covered. You can drop the pants away underneath it. The person is still covered. They wear it into the shower. Have the soap put on it and washed through it. Then they come out of the shower. You wrap a towel around with use the same clips, and they're covered while you're drying them. Then you put their shirt on and you pull your pants up, and they're totally covered the whole time.
That is miraculous. I mean, that is so compassionate and respectful. I mean, because we would want to be treated that way. Yeah. Can you imagine going, no. And then I'm not in my right mind. No, my. Yeah.
And I think I'm fearful because I'm being undressed, and what are these people going to do to me? And something like 1/3 of women have been sexually abused at some stage in their life. So you've got that memory of that, often trauma that's not being dealt with. So all of that are compounding, and maybe a male caregiver who's doing this to them. So that even increases it all the more. So you get the anger, you get the fear, either the flight or the fight.
I did have to move my mom at one point because she began reliving the trauma from childhood, from like when she was 5 to 10 years old. And she had it in so much detail, and then she had worked other names into it that I was never sure if it was someone there. I don't know if it was right. Mm-hmm. Yeah. I ended up moving her, and I also put video in her room, which they said okay, the administrator did, but I moved her. I just couldn't stand the thought that for whatever reason she was triggered big. I mean, it was day after day after day. So So, hey, tell us about your book. It's coming out.
On to the publisher. It's A to Z of dementia care, solving the puzzles to deliver excellent care. So I've had a friend read it, and she just sent a little blurb for me saying that it was the best thing I could have given her, early access. Her husband's recently been diagnosed in the last 9 months. And she's been able to dip into it and find the bits she wants. She's been able to, she didn't have to read the whole thing. She just she was able to find out the parts that she wanted to do and know. And she's really recommended it. So, yeah.
Say the name of the book again.
A to Z of dementia care, solving the puzzle to deliver excellent care.
Awesome. And it is, you shared a little bit of it with me, and you could just flip through and find out exactly what you're searching for. And it is cutting edge. That's what I felt like about your book, Isabel, is it's cutting edge on dementia care completely. It is not standard, oh, you know, you do this 1, 2, 3 thing and it's taken care of. So I commend you for sharing all of your knowledge and experience with everyone. It's going to be great. And it's also coming out kind of as a textbook too for.
Yeah. Yes, it can be, as my psychogeriatrician friend said, it can be read by caregivers, doctors, nurses, personal carers, across the board.
Yeah, the way you write is brilliant because of that. Because all I knew is dementia part, not from a doctor standpoint or anything, but it didn't matter that you were so, it's brilliant. I can't wait for it to come out, like hold it in my hands. That's awesome. Also, when is it coming out?
Well, I'm hoping September, October, which is Alzheimer's Week in Australia, Dementia Awareness Week.
Wow, that's awesome. That's awesome. Also, how could a family, or do you, I don't know if you offer this, how could someone contact you if they need more interest? Do you do some coaching or something? Or
I recently did, and I'll probably be charging for it, but I will do online Zoom sessions with anybody who needs it. I recently, one of our fellow writers that some of you know, her mother-in-law is developing dementia, and they were both sons lived in separate states away from her, and I did an hour Zoom session with them, just helping them understand what was happening and giving them some
how
advice.
can they contact you then? What would be the best way? Isabak,
ISABAK 7 at gmail.com.
Okay, ISAB, like in boy, EK 7 at gmail.com.
First 3 letters of my surname and first name and surname.
Yes.
Yes.
Isabak 7 at gmail.com. Awesome. Yes. Thank you so much. Thank you, Lila and Cindy, for joining us. And I'm glad that you prompted me on some of that story stuff, Lila, too. Thank you so much, Isabel. You're a jewel. You're a good friend.
Thank you.
Thank you.
Yes. And thank you, Kay-Nell, for setting this up. This is great.
Sure. I'm just thrilled. Can't wait for your book.
Yes.
I'll be watching for it.
Yes.
Thank you.
Thank you.
See you ladies later. Bye.
Thank you. Bye.
Bye-bye.
Thanks.